trauma is really a transfer of force to the body. It's usually classified as either blunt or penetrating. Blunt trauma is anything that strikes the body, or if the body strikes an object and causes injury to the tissues.
The things we see the most here are falls. We get a lot of falls because we have a lot of nursing homes around here, and then we get a lot of motorcycle and motor vehicle. This summer's been very busy with motorcycles and side-by-sides. We've done a lot of those type of injuries this year.
So, I mean, we've been acting like a level 2 trauma center for as long as we've been in existence. So we've had to prove ourselves, and now it's just a stamp of approval, but the services have been here, and we've tweaked the services. We've been held to that standard even before. The main difference is the services that are available. So non-trauma centers don't necessarily have a surgeon available within minutes, really, 24/7. So any other hospital may or may not have surgical coverage. They may not have, they probably do not have surgical capabilities, meaning the surgeons are not trained in trauma-specific surgery. So it's not just the 24/7 surgical coverage, but it's people who did extra training and fellowship training in trauma surgery.
I think for us here, we started this journey a couple of years ago because we wanted to bring quality trauma care home to our community here. And I think we were on a really good journey, and then once Dr. Elephant joined, we really got that full momentum going. So I have to give him a lot of credit for really getting the physician side of the support that we needed. So now our patients, they can come here. We have a dedicated EMS service that is hospital-based, which is a very important thing to have with trauma. They come here, our team is waiting, we give 24/7 care. We have an amazing rehab center, so their care can all be done here within their hometown, so they don't have to travel. So that's a huge benefit for patients and families, that their care can stay here in our community.
The last couple of years, there have been a small subset of patients who needed very timely care. Trauma care is very much dependent on time, and they need to be at a trauma center with the capabilities that we have here. And had we not had the capabilities here, those patients would not have survived that trip, even 45 minutes to a trauma center. So we've seen at least a handful, if not more, of patients that survived because we had the capabilities, the trauma-specific training that the surgeons had here, and they didn't have to travel far for their care.